Insights from the world's best medical minds. You are watching therightdoctors.com.
I am Dr. Om Prakash Singh. You are watching me on therightdoctors.com, India's leading medical knowledge platform. I am Dr. Om Prakash Singh. I am professor in psychiatry in the West Bengal Medical Education Service and editor-in-chief of Indian Journal of Psychiatry. So today I will be talking about depression. We are always hearing about depression, what it is. There are a lot of confusion. When we think like something is happening to us, some bad thing happens, we feel sad. So whether it is depression or not. So what is depression? What we psychiatrists understand by clinical depression. It is different from the distress. Distress is something which happens due to some situation or condition. It is short lasting. It lasts for 1 or 2 or 3 days. Then the person gets well. But in depression, by definition, it has to be 14 days. So 14 days, patient feels sadness, loss of pleasure. That means that he does not enjoy anything which he previously used to enjoy. Like he used to like watching movies, but he no longer enjoys that. He used to like meeting friends, but he no longer enjoys that. So these things are loss of pleasure in each and everything. Then decreased concentration leading to decreased motivation. Person does not feel like doing his work, completing its work, find it very hard to complete his job. Then there is decreased sleep. Sometimes it may be increased sleep also for some people. Then there is decreased appetite or sometimes increased appetite. So person may have a change of what we call in weight, which is 5% in a month from his baseline weight. Then there is inappropriate guilt. We all has something bad in our life, but these persons feel guilt which is disproportionate to whatever has happened. Maybe they have talked badly with someone, they will give lot of salience, lot of importance to this and say that I am guilty, I am not a good person. Then the feeling of hopelessness, helplessness occurs. Hopelessness means that there is nothing going to happen in future. Nothing will be right for me in future. And helplessness means that there is nobody around me which can help me. Everything is banned around me. So I am helpless, I am hopeless. And this leads to suicidal ideas and sometimes suicidal attempts. Sometimes person succeeded in those attempts. So this is basically depression. So first thing we have to understand that this is an illness which is long lasting, at least 14 days has to be there. Symptoms are Symptoms are decreased sadness of mood, loss of pleasure, decreased sleep, increase or decreased appetite, then guilt, feeling of guilt, suicidal ideas, feeling of hopelessness and worthlessness. And of course, it is different from distress. Almost everybody feels sometimes in their life when some bad things happen to them. So what is depression? What happens? People say that you can snap out of it. If everything is all right, everything is happy, why you are feeling sad? So basically, there in depression leads to a lot of brain changes. When these brain changes occurs, your capacity to process information changes. You do not process the information of external world in same way as we normally do. I give an analogy of like person is wearing black glasses. So everything will look black and bleak. So for depressive patients, everything looks negative. If he thinks about his past, he will remember only the negative incidents in his life. If he thinks about present, he will think only negativity. And of course, if he thinks about future, so there is hopelessness in them. So this processing changes, and this processing cannot be just corrected by asking him to, okay, you try. You try is not going to help. I will give you another analogy. Like you have fallen in a well, which is walls are around 15 feet, and you can jump around 5 feet. So if everybody asks you to jump, 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 you go on trying, but you are not going to succeed. So you need help, help in the form of treatment, which may be in the form of medications or which in the form of psychotherapy, depending on the severity of your conditions. So telling someone to snap out of it, telling someone that you can do it is not very productive. It is not going to help that person, but it is going to make that person more uh, thinking of himself as more of a failure, that I am trying, I am not succeeding. And then people talk about that what happens to the social media, how social media affects the depression. The social media has two characteristics. One is most of the time people post their pictures where they are very happy, they are doing something, going to hotels, doing this, doing that, enjoying life. So when this person who is depressed sees this, he or she thinks that, okay, everybody is happy except me. I am the person who is very unhappy, and everybody is enjoying life, but I could not do it. And that's time his negativity increases and his sadness increases. Another aspect is that if he or she reads about negative news, also they try to over identify with that news, and again they become sad. So, in both ways, this affects them negatively. Even if they read positive, they do not find that they are only unhappy. Everybody is happy. Or if they negative news, they over identify that with that, and also become more sad. So, social media most of the time affects them very negatively. Then another question is that people talk about whether taking antidepressant is good or bad. Like, now we are saying that diabetes and depression are same kind of illness. They are the chronic illnesses of the different organs. Depression is the disease of the organ of the brain. Diabetes like the disease of the organ of the pancreas. For diabetes like itself, you need drugs and also lifestyle changes, like reducing your sugar intake, exercise. So similarly for depression also, you will need drugs and also some other form of behavioral changes. And it is not that you have to take medications lifelong, which occurs in very few cases of depression. Depression is what we call self-remitting disease. Depression gets well in some time, but problem with that is we cannot wait, because person can commit suicide during that time, and it may lead to loss of that person. So that is the thing which is very important for depression. Then there another question is depression is lot of the time is uh, fixed with anxiety. There are a lot of anxiety in depression, what we scientifically call comorbidity, like depression and anxiety, and otherwise anxiety is part of depression. So I will try to explain you what is anxiety. Anxiety is like, we say fear and anxiety. We are animals. So nature has given us fear. So if you see something threatening, so our body goes into a mode which what we call fight or flight. So over secretion of noradrenaline, steroids, sugar, glucose in muscles, so that we can run or we can fight. But in case of anxiety, most of the time, the thing is in our mind we think that this may be dangerous to us. So, but body will not be able to distinguish between real threat and one thing which we think that this may be a threat. So, body goes into this hyper mode of fight or flight. But since it is in our mind, or sometimes in situations we cannot escape, we cannot fight, or we cannot flight. Both options are close to us. Most of the situation in life situations, but body is going into hyperdrive, putting more glucose in the system, more steroids in the system, which ultimately leads to lots of harm in the long term. Because all these mechanisms are meant for short time, not for longer time. But this happens and this leads to then ultimately people suffer from diabetes, hypertension, decreased sleep, hypervigilance. All these changes occurs because of most of this anxiety symptoms. Then people are asking about uh, lot of questions has come out, right? What we should be doing in COVID, because we are locked down, we do not have uh, access to our friends, or in general, what we should do about our anxiety things. So we understand that anxiety is our tendency to over worry. We are worrying about things, we are apprehensive, what will happen. We have to understand that even bad things are less bad than what we imagine them to be. Suppose a person always worried about failure in exams, even if failure occurs, it is not so bad as he has imagined. So you have to remember that. And anxiety is also a disorder, and if it is severe enough, you need treatment in forms of medication or psychotherapy. But you can do other things to reduce your anxiety. First, first thing is that you have to understand that we cannot control everything. In life, lot of things are uh, not in our control. You take this corona pandemic. Life was going smoothly. People have planned for their life. They have planned for their future journeys. But suddenly, every plan has gone dumb. So every plan has been, we cannot execute them. So it is not in our control. Corona pandemic we cannot control. So most of the things, lot of the things in our life, we are not able to control. So we first have to understand this, and acceptance is required that everything is not in our control, and we are not responsible for everything in our life and changing everything in our life. Then second thing is most important is to move away from negative situations and negative people. You will find that your experience will tell you that there are friends, there are other people who does not bring happiness to you, who does not bring calmness to you, but they provoke anxiety. So you have to try to move away from them as much as possible. Similarly, the situations, the other things where which make you anxious, reading new, seeing news, watching news, tracking share market on daily basis. So you try to avoid those activities. Then you try to do some deep breathing and relaxation exercises. Again, exercise is a very good thing. Bring regularity to your life. Try to sleep at a particular time and wake up at a particular time. Sometimes people self medicate them with drugs and alcohol, which have rebound effect. It temporarily calms the anxiety, then after rebound it increases. So you try to keep away from them, and if it is in spite of this it is persisting, you need treatment, you seek help in forms of, again, you reach out to friends, you talk with them, you reach out to professionals and get proper treatment. We are always saying that it is not a weakness. Strongest people have depression, strongest people have anxiety. This is the how their brain function. And telling someone that okay, everything is good around you, why you are feeling sad, is like telling a patient of bronchial asthma, look, there is a lot of oxygen in atmosphere, but why you cannot take it, why you are feeling so respiratory distressed. So we have to understand this, and the person also self blame them for having depression, because people's attitude is like this. They think that no, I am a failure, I'm not strong enough. So that is not the cause. It is a disease which affects your brain, which is not in your control, and but it can be reversed by proper treatment, proper guidance. So hope, keep keep hope about the future, keep hope about the treatment. Another question people have been asking about how to help themselves in terms of COVID-19 lockdown. The first thing, we have been very active, and suddenly we are limited to our rooms. We cannot go out. we cannot talk with people, we cannot perform activities which we have been regularly performing. So first thing is that we should take this an opportunity. Okay, we have been given a rest which we have been seeking on. Lot of time we have imagined that okay, we have some days where we do not have to worry about doing things. So take this as an opportunity. Then increase family bonding, then perform some exercises, do something which you have always liked to do, or it is not always that you have to do something. You can just relax, enjoy films and other things, and spend some time. And do not see lot of television news about corona. Do not read everything goes on reading about corona, because it is going to make you more anxious, more worried, because situation is not going to change by you reading every time. Every minute if you read, it is not going to change. Changes are occurring at a macro level. So do not do much more research on corona. uh, we have to follow whatever is being guidance is being given to us, and then utilize the time as a form of bonding, form of sharing, and also try to help people who are less privileged than us in our neighborhood. Do something for them, help them, because as a human being, helping someone leads to secretion of pleasure hormones in our brain and leads to sustain our system. Our system gets repaired. Those enzymes, those hormones repair our system, and we feel good about it, and it gives us resilience. So that is the way we can keep anxiety away from us. Another thing must talk about being a psychiatrist, like ECT. There is lot of negative things about electroconvulsive therapy, which is colloquially called as a shock therapy. People view it very negatively, but nowadays, like in heart disease, if heart is not performing, it is having arrhythmia, you give cardioversion or shock treatment to the heart. You must have seen in the films. So similarly for brain, ECT is applied, and it is the treatment of choice for particularly patients who are depressed and suicidal. For suicidal patients, it is the treatment, and nowadays under anesthesia, it does not look bad. Person does not feel anything bad about it. Patient, it is like any operative procedure, very safe, very simple, and very effective for suicidal depression. Because of this stigma, a lot of people do not get this treatment, and ultimately we cannot manage a lot of suicidal patients. We fail to manage them. So this stigma has to decrease, and whenever doctor offers you a choice of electroconvulsive therapy, does not think that this is a last treatment, does not think that this is bad treatment, does not think that this will harm your brain. Please try to accept it. It will be explained by your doctor. This is life-saving treatment in terms of suicidal depression. Thank you to all of you to listening to me. I have today talked about depression with anxiety symptoms. Thank you again. You are watching me on the therightdoctors.com, India's leading medical knowledge platform.
Insights from the world's best medical minds. You are watching therightdoctors.com.